Today, I'm doing my part two analysis of the situation presented in the Insider article by Anna Medeiros, where Dr. Christina Johnson states, I'm a doctor and I know what it's like to be gaslighted as a patient. Here's what I do to advocate for myself in a medical setting. Last time, my focus surrounded Dr. Johnson's account of her having spent many years complaining of increase in bleeding, pressure, and pain during her menstrual cycles, only to be dismissed or ignored, or even treated in a way that was rough when she presented as a patient. She was forced to manage her symptoms on her own until she became a medical student at Howard, where physicians listened to her and properly evaluated her concerns. She found out that she had likely had uterine fibroids for years and was finally made aware of her treatment options. My last video was about doctors who offer inferior care due to their own emotions and their inability to regulate them, and is linked in the description below. There are more issues to tackle in this article, including what to do when you feel unheard as a patient. So again, Dr. Johnson feels she likely had fibroids for many years before her diagnosis, but because of her age, the possibility of fibroids was not meaningfully explored. It is true that uterine fibroids usually present more often in later life, and it would not typically be at the top of mind for a young college student. However, such a situation is not impossible, and for reasons I'll elucidate later, Christina's presentation might have warranted this unusual consideration. If you have such a case, one where your presentation is discordant with your ultimate correct diagnosis, you could find yourself in quite a frustrating situation. All clinicians, and all humans for that matter, are inclined to identify and recognize patterns. Being skilled at this aids in the ability to quickly assess situations and make decisions. And this skill is particularly coveted and rewarded in the field of medicine. But you may not fit a common pattern, or your pattern may not place you in the usual category. Physicians don't like when this happens. Some are reluctant to even acknowledge the possibility. This could mean a protracted course for you in arriving at the correct diagnosis or care, or worse, that correct diagnosis may never come or come too late. Sometimes doctors will even allow their negative feelings regarding your unusual case to corrupt their view of you as a patient. Perhaps this was one of the reasons for the rough treatment Christina described in this article. As I said in the last video, if you are chronically being treated rough by your provider, I suggest arranging to get a new one when safely possible. But what if everywhere you go you feel your care is inadequate, ineffective, or even abusive? Well, first of all, recognize that your perception is probably spot on and you are not crazy. Despite being ill treated, you could have very possibly done nothing to deserve what's happening to you at every single appointment with every single physician. For reasons I will address in a future video, there is a long tradition of tolerance of inept care when it comes to patients with unusual cases who don't fit into established categories or respond to agreed upon algorithms. Before I attended medical school, I used to watch House, an American drama series where patients would present with mysterious symptoms. The episodes depicted the main character House with a team of young doctors who would all rush to the side of patients manifesting symptoms that always seemed to refute the initial diagnosis of the team of doctors. The sicker the patient got, the more they would all care, and the harder they worked to figure out exactly what was going on. If you have been one of these patients in real life, I probably don't have to tell you that this is not usually how it works. You don't usually have a team of doctors spending all day trying to figure out your case. They are often not so sympathetic to your symptoms, and too often, the more difficult you become to diagnose, the more likely you are to get tagged with a negative label. Many times, It isn't a stretch to conclude that your particular presentation may be causing your subpar care, and it may be happening everywhere you go. Let's look at this post from Reddit. I lost 75 pounds so doctors would stop blaming everything on my weight. I am 5'6". I was 210 pounds before and now 135. It took me a year to lose it all, but what finally pushed me to lose the weight was because every single thing I went to the doctor for, it got blamed on my weight. Severe cramps? Weight. Feeling sleepy during the day? Weight. Numbness in my fingers? Headaches? Memory problems? Balance problems? Weight. I recently went back to my doctors, who of course applauded the weight loss and wrongly assumed all of my problems were gone. When I said no, they hadn't, they immediately ordered an MRI, sleep study, and lapro, which they hadn't done before the weight loss. The MRI found Chiari malformation. The sleep study slash physical found out I had an oversized uvula as well as narcolepsy, and the lapro found so much endo, I lost both of my ovaries and a portion of my colon and lower intestines. If it had been taken seriously a year ago, I might not have lost them. Goodness, my heart breaks for this abused woman, and I don't think abused is too strong of a word here. In situations like this patient's, often they are figuratively beat into submission. They learn to begin every complaint with, I know I need to lose weight, but I'm having difficulty with fill in the blank. The abused patient is scared to even voice a new complaint at all. The abused patient starts to believe they are crazy or wrong or unworthy. The abused patient eventually believes they are beyond help. Thank God this abused patient from Reddit decided not to give up and found a way to be heard and properly evaluated. But what if she had not lost the weight? What if she couldn't? What if you are an abused patient and fresh out of ideas? Well, first, I want you to get your hope back. If you have a persistent issue that is untreated, undertreated, or even unidentified, I encourage you not to give up. Be willing to see other physicians, travel, or try different modalities like web consultations with licensed providers. Physicians do, in fact, have more training, but sometimes mid-levels like physician assistants or nurse practitioners listen and educate better. Another thought here, do you have a friend who loves her doctor? Maybe check them out. Whoever you decide to seek for medical care, I want to offer my tips, just my opinion, on how to overcome barriers to proper care when you have a persistent issue, as did Christina, now Dr. Johnson, from that Insider article. Returning to her case, remember, her problems were bleeding, pressure, and pain during her menstrual cycles, which presumably were symptoms ultimately attributable to her undiagnosed uterine fibroids. So now that we have the benefit of hindsight and can look back knowing the correct answer, let's talk about steps that may have helped from day one, the first time of the first visit. This is my first tip. Be ready to give concise but complete and accurate information. So you go to the doctor and you say, I have increased bleeding during my cycle. But this is what the doctor may hear. Patient reports increased bleeding, and so does most every other college freshman around the start of the semester. It's probably a little extra bleeding because of the stress. But what if you are Christina and you know that your bleeding does increase with a little stress, but this is beyond that? In this case, you think you've reported your symptom accurately to the doctor, but maybe that isn't what the doctor heard. To avoid this, try instead to objectify your reporting as much as possible. Consider this way instead. Doctor, I have increased cycle bleeding, meaning that instead of 6 pads a day and changing every 2 hours, I'm requiring at least 10 pads a day, and I cannot sit through a single lecture all the way through. I have been stressed before and had to use a couple of extra pads during the day, like when I was studying for my SATs, but I have never had to buy this many products during a cycle, and I don't know how I'll make it through the semester and complete my classes with what I have going on. So, what did you just tell your physician when you said it like this? You made it clear that there has been a change, a significant one, and it is significantly disrupting your life. To most well trained physicians, this signals that something needs to be done, whether it be further workup of your issue or treatment or both. In this same vein, I recommend seeing your provider for one issue at a time. The narrative I just demonstrated will be better heard when it is the complaint you are presenting for and not something pasted in the middle or appended on the end of your visit. If it is disrupting your life, that problem deserves its own appointment, not you presenting for a physical and then saying, oh, by the way, I've been having bad periods. Even then, it should be thoroughly questioned and explored as appropriate. But if you've made it this far in the video, you probably know that it doesn't always happen appropriately. Give yourself the best chance for the best care. Next item. Christina's age. As I alluded to earlier, uterine fibroids aren't usually a young woman's problem. However, exposure to estrogen is a known risk factor for uterine fibroids. This means a person who started their cycles at a young age are at higher risk, someone carrying more weight is at a higher risk, and for unknown reasons, Black women are at higher risk. Not just American Black women who tend to be larger, but even non American Black women who are not larger. That being said, and without knowing Christina's full medical history, we can identify at least one risk factor she had for having a greater chance at uterine fibroids, and that is she is a Black woman. So, this brings me to my opinion that if you have had trouble getting to a correct diagnosis, it may be wise to seek a provider familiar with your particular demographic. If you are in college, for instance, as Christina was, and you go to see the campus doctor at the college's clinic, look around and ask yourself, is this doctor used to seeing people like me? I only suggest making this consideration if you have had repeated difficulties getting a chronic issue diagnosed. I place this under the category of last resorts. Sometimes your unusual presentation is not so unusual among the population you are from and among the doctors who regularly treat that population. I had a difficult to diagnose problem during my last year of college, and it turned out to involve a sensitivity to a certain protein. I went to multiple physicians and received incorrect diagnoses and sometimes no diagnosis at all. Once I arrived back to my home state and was able to see my regular physician, who happened to mostly serve a population matching my background, she nailed that diagnosis and treatment on the first try. And with that, we'll place a bookmark here as my final tip involves an extended discussion on overcoming stereotyping. Please join me for the conclusion to my analysis of the article about Dr. Christina Johnson and her experience in facing barriers to safe, quality care. One more thing though, to implement the suggestions offered here, it will take some intentionality and planning. Imagine you have this medical problem. You've been dealing with it for a while now, and you're finally going to get an appointment with a physician. But your appointment is at 2 p.m. and you were supposed to leave work by 1:30, but things got busy and now you're rushing. And oops, you forgot about that super slow school zone and super slow buses letting kids off. You finally arrived to your appointment at 2:07. You check in, and the front desk folks are rolling their eyes, reminding you that you should have been here early to fill out your paperwork. The doctor agrees to see you anyhow, and that's good, but now you're stressed and you're just meeting this doctor, whoever, and now you're supposed to recall the amount of times you had the pain or the problem in the past week, for how many minutes, what time of day, what intensity, where it radiated, what you ate, and every other pertinent detail. My point? Plan well for your visit. Write down exactly what you want to convey. This is a space where sites like Mayo Clinic and WebMD can actually be useful. Don't walk in citing info from those sites with a grand hubris and ego and provoke the physician to feel they have to put you in your place. Rather, these sites can really help you prepare for the questions you'll be asked. And if you see a diagnosis that seems to fit, don't be afraid to mention it. When doing this, again, it would be advisable to err on the side of humility. In the current healthcare climate, there are many reasons physicians feel more challenged than ever by administration, insurance companies, and the overall bureaucratic process that insult their knowledge and training. You don't want to be perceived as yet another challenge to their autonomy and practice of their craft, but most physicians do want you to be straightforward about what you are thinking. So instead of saying something like, I went through the WebMD symptom checker and it said I probably have pneumonia, consider, I've been coughing a lot and it seems difficult to breathe. Is there a chance I have pneumonia? The most important adjustment here is not the specific words chosen, but the attitude and approach for bringing up your suspicions and concerns. Okay, now that really is enough for today. If you would like to speak to me one-on-one, free of charge, to get my opinion on ways you can advocate for yourself in your specific medical situation, you can reach me at Dr. Anise at a-hth.com or dranise@gmail.com. And if you want to share your own experience or have something regarding patient advocacy and safety, please leave it in the comments below. I love y'all.